Thank you for viewing this educational presentation. This module discusses transurethral resection of the prostate. The TURP or TURP procedure involves coring out the prostate tissue that blocks the urine channel or urethra. It is most commonly done for non-cancerous or benign enlargement of the prostate. Rarely it is done in other situations, such as for obstructing prostate tissue following radiation for prostate cancer. The prostate is a small gland situated at the bottom of the urinary bladder, the place where urine is stored. It surrounds a portion of the urethra, the tube that carries urine from the bladder out through the penis. A man's prostate enlarges or grows bigger as he ages. This common non-cancerous enlargement of the prostate is called benign prostatic hyperplasia, or BPH for short. The growing prostate can cause trouble when it tightens around the urethra, obstructing urine flow, impairing bladder emptying, and causing frequent, urgent urination. These illustrations show the prostate as your surgeon would see it through a telescope called a cystoscope. You can see that as the prostate enlarges, it grows inward, blocking off the flow of urine through the urine channel called the urethra. When left untreated, BPH and other obstructing conditions of the prostate can lead to a total inability to urinate called urinary retention, which requires insertion of a tube called a catheter into the bladder. It can also result in blood in the urine, weakening of the bladder, bladder stones, urinary tract infection, or even kidney damage. Treating obstruction caused by the prostate such as BPH may involve regular monitoring of symptoms, medications that relax the prostate, medications that shrink the prostate, combination therapy of both types, or surgical therapy. This slide gives you some of the many surgical options that your surgeon has to choose from. Many different so-called minimally invasive procedures have been developed, but none of them to date are mainstream. Standard surgical therapies range from laser therapies to transurethral resection and finally to open surgery. Surgery is considered for patients who are unable to urinate, who have kidney damage, frequent urinary tract infections, significant urinary bleeding, or bladder stones. Surgery is also recommended when medication fails to satisfactorily relieve urinary symptoms. This, in fact, is the most common reason that surgery is recommended. As noted earlier, TURP or TURP stands for Transurethral Resection of the Prostate. Some surgeons also use the term TUPR or TUPR, which stands for Transurethral Prostatic Resection. This operation involves removing prostate tissue that is squeezing around the urethra and obstructing urine flow. Removing this obstructing tissue opens up the urine channel, allowing urine to flow more freely. This in turn allows the bladder to work less hard to empty, which relieves bladder symptoms such as frequent and urgent urination. This slide shows the prostate gland and the urethra, before and after surgery. Urine flows easier once the obstruction has been removed. Prior to a TURP procedure, you will undergo a medical interview or history, as well as a physical exam. You may have blood and urine tests performed, along with other tests as needed, such as an electrocardiogram, which is a heart test. Your doctors will review your list of medications and advise you on what medications to continue taking, and which ones, if any, need to be stopped. It is important to pay careful attention to these instructions, particularly with blood thinners, heart medications, and diabetes medication. Blood thinners, for example, usually need to be stopped well in advance of surgery. Ask your doctor if you have any questions or concerns about this. Like most surgeries, preparing for a TURP simply involves eating a light meal the night before, then not eating or drinking after midnight or as instructed by your providers. Try to get a good night's sleep and relax as best as possible leading up to surgery. On the day of surgery, you will be checked into the hospital and asked to change into a hospital gown. Your doctor and the anesthesiologist will meet with you, and then you will be taken to the operating room by a nurse or assistant. In the operating room, or perhaps prior to going there, an intravenous line or IV will be started, through which you will receive fluids and medications. You will be given an anesthetic, which is medication that blocks sensation of pain. If you are given a general anesthetic, you will be asleep for the surgery. If you are given a spinal anesthetic, which involves passing a needle into your back, you will remain awake, but the lower half of your body will be numbed. Spinal anesthesia is often preferred for patients undergoing TURP. The surgeon will insert a small instrument called a resectoscope into the urethra and toward the prostate. The resectoscope is used to remove the obstructing prostate tissue. These images show how the resectoscope device is used to clear away the obstructing prostate tissue. At the end of the procedure, the surgeon will insert a small tube called a catheter up through the urethra into the bladder. The catheter is connected to a drainage tube, which is connected to a drainage bag. The catheter is also usually connected to an irrigation tube, which allows water to irrigate through the bladder and clear any blood away. The entire TURP procedure usually takes about 20 minutes to an hour. Once completed, the prostate tissue that is removed will then be sent to a lab for close examination. Your doctor will review the results of this examination with you at your follow-up visit. After surgery, you will probably stay in the hospital overnight or for 1 to 2 days. In some centers and in certain circumstances, you may be sent home on the day of surgery. You should feel little pain, although some patients do experience uncomfortable bladder spasms which can be controlled with bladder relaxing medications. You will likely notice some blood in the urine, which is normal. It is important to understand that just a little bit of blood in the urine can look quite striking, but it does not necessarily mean that there is significant bleeding occurring. Bladder irrigation is continued until the drainage is felt to be clear enough to stop it. The catheter is then left to straight drainage for a period of time, and if the urine remains clear, the catheter is removed entirely. This usually happens the day after surgery, but maybe a day or more later in some situations. Occasionally, some patients are sent home with their catheter in place. If this is the case, your doctor or nurse will teach you how to care for the catheter yourself. In other cases, patients are taught to catheterize themselves intermittently to empty the bladder. Separate modules are available that detail catheter care and intermittent catheterization. Recovery from a TURP typically takes about 2 to 6 weeks. You should immediately notice an improvement in urine flow. Urination may be frequent and mildly uncomfortable during the recovery period, but frequency and pain will gradually diminish over the first few days to weeks. It may take a few months until the final results of surgery are known. It is not unusual to see a small amount of blood in the urine initially, but bleeding should not be continuous. You may have some blood off and on in the urine for up to several weeks. It is important to keep your fluid intake up once you get home to be sure that any blood clears from the bladder. A common instruction is to aim for 8 ounces of water every couple hours. You should most likely resume all your usual medications once you are home, but check with your doctor for individual instructions. Remember that aspirin-containing products and some supplements can increase bleeding after surgery. You may receive 1 or more prescriptions at the hospital, and if you do, be sure to take these as instructed. It is important not to strain for bowel movements after a TURP to avoid causing bleeding. Therefore, you should take efforts to keep the stools loose, and you may need to take a stool softener. Ask your doctor or pharmacist if you need guidance on this. You may bathe or shower as usual once you are home after a TURP and your catheter is out. General recommendations are that you should avoid vigorous exercise and lifting anything more than 20 pounds for 4 to 6 weeks. Consult your doctor for specific instructions and if you have any questions or concerns following surgery. Sexual activity may be resumed after 3 to 6 weeks, as per your doctor's instructions. If the TURP procedure was uneventful, erections should not be affected. Problems with erections are uncommon after TURP. If you are able to maintain an erection beforehand, you should be able to do so after surgery. Most sexual pleasure is expected to be recovered a few weeks after surgery, and men typically find little or no difference in the sensation of orgasm. About 2 out of every 3 men, however, will experience some change in ejaculation after TURP. Most commonly, men experience what is called retrograde ejaculation. This means that during orgasm or climax, the semen fluid goes backwards into the bladder instead of projecting forwards. Although it may be alarming at first, this should not be a cause for worry unless you're still trying to have children. It will not affect your sexual function in any other way. Some men find that ejaculation feels a bit different, but it is certainly not painful. After surgery, up to 10% of men cannot completely empty their bladder. This could be due to a weak bladder muscle, a blood clot, obstruction, or the surgery not removing enough prostate tissue. Catheter use and irrigation or flushing of the bladder might help if there is blood. Occasionally, your doctor may need to re-examine you and perhaps remove more obstructing prostate tissue if necessary. Nearly 90% of men note significant improvement of urinary symptoms after TURP, making it the true gold standard of treatment for an obstructing prostate. Studies have shown that no medical therapy or alternative procedure has achieved as high a success rate as TURP. For patients with predominant symptoms of frequent and urgent urination, these symptoms will improve 2/3 of the time. This slide lists the most common possible complications of the TURP procedure. It is possible that some of these numbers may have improved in recent years owing to improvements in technology. Less common complications that can occur during the operation include injury to the bladder, rectum, or ureters, the tubes that drain urine from the kidney. Loss of urinary control, called incontinence, and transurethral resection, or TUR syndrome, are also rare complications. TUR syndrome is a rare event caused by excess fluid absorption into the body during surgery, which can cause dilution of the blood. This can lead to heart failure, confusion, seizures, coma, and even death. TUR syndrome has become a rare complication because special measures are taken to prevent it. Patients are carefully selected who will be less likely to experience this complication. In the operating room, special fluids are used which are less likely to create problems. Furthermore, patients are carefully monitored for early signs of problems. In the rare instances when TUR syndrome does occur, special medications and fluids can successfully treat it. Patients who have had prior radiation to their prostate for prostate cancer are at higher risk of some of the complications of TURP. Some other factors that may increase the risk of complications include obesity, smoking, poor diet, alcoholism, diabetes, heart problems, and certain drugs and supplements. It is very important that you inform your doctor of any medication you take and any health conditions you might have. To summarize, TURP, or TURP, is a surgical procedure used to remove obstructing prostate tissue, allowing urine to flow better and relieving bothersome urinary symptoms. It is one of the most frequently performed urologic operations due to its high effectiveness and low complication rate. It remains the gold standard against which other treatments for an obstructing prostate are measured. Thank you again for viewing this presentation.